Hello and welcome to this Q&A from the Fertility Alliance. Today we're joined by Stuart Lavery, who's the Director of Women's Health at UCL and a consultant gynaecologist who specialises in fertility and reproductive medicine. And we're going to be talking about what to expect on your very first visit to the clinic. So Stuart, I wanted to start by asking you, if you had a partner, is it important that you always go to that first appointment together?
I think it's really helpful if that's possible. We always see fertility as a joint venture, and both partners have a really important role to play. And I think also sometimes you receive so much information at your first consultation to have two sets of ears and two brains to process that can be really helpful. I also think it helps see fertility as truly usually a male and a female issue, which I think is helpful. So we would always encourage it.
And is there anything you need to bring with you or that you need to think about doing before that appointment?
Okay, I think preparation is really important here for you to get really the maximum amount of impact out of your consultation. So if you've had any tests or any investigations done elsewhere, please do bring them along. They are hugely helpful and can often mean that unnecessary investigations don't have to be duplicated. So bring everything along. And I would also bring along a list of questions or concerns. All too often, when we find ourselves in doctors' offices, we forget to ask the questions that were on our mind and we remember them when we're out in the car park. So writing stuff down is hugely important.
And at most clinics, who are you likely to see at that first appointment?
So the first appointment is usually with a doctor, and that doctor will take a history from you, inquire about what's going on, how long you've been trying for, and get some specific pieces of information around your medical and gynecological history. We are seeing a move towards initial nurse consultations, and that's particularly true in the private sector. So you may see a nurse initially who will take a history from you and sometimes arrange some baseline investigations, such as blood hormone profiles and ultrasounds. And then when you see the doctor as a secondary episode, sometimes all of those tests and investigations are to hand and you can have a much more in-depth discussion. So it can vary depending on the clinic and the service that you're seeing.
And what sort of questions might you be asked at that appointment?
You'll be asked some really basic things. So you'll be asked how long you've been trying for. You'll be asked how regular are your periods, whether there's anything significant in your gynecological history, such as abnormal smear tests or previous pelvic infection or ovarian cysts. And you'll be asked about previous pregnancies, whether you have children, whether you've had pregnancies that have ended in miscarriage or ectopic pregnancy. And then there'll be some general issues around, are you on any medication? Do you have any allergies? Are you a smoker? And then perhaps some more intimate details, such as, around the time of ovulation, how frequently are you having sex? So you've got to be prepared to have some pretty straight discussions. And often it's really good to attend as a couple so that all of those informations can be taken firsthand from each individual.
Is it usual to have a physical appointment, physical examination, sorry, at that appointment?
So in the past, the answer would have been yes, but that's becoming a much rarer event. And the reason for that is most patients are being referred to an ultrasound scan. And actually, an ultrasound scan gives you a much, much more accurate idea of what's going on with your anatomy than an examination. There are some specific circumstances where examination is important, particularly people that have pelvic pain or pain on intercourse. Often then an examination can be very helpful. But I would say the majority of patients now who are now going to be going for scans, you get more information from the scan than you do the clinical examination.
And what kind of tests might you actually have on the day?
So it depends a little bit about the service that the clinic can offer. There are some clinics that really do offer a true one-stop service. And you could end up having bloods taken for hormone profiles, ultrasound scan to check for pelvic anatomy, and sometimes the semen analysis on the male partner as well. Sometimes with those investigations, it depends a little bit where you are in your menstrual cycle. For example, some of the blood tests are best done a week after ovulation. Others are best done really early in the cycle. So even with a clinic that does have a one-stop service, because of this issue around biology of the menstrual cycle, sometimes you may need to go to the clinic on more than one occasion to have the tests completed.
And why is it that sometimes, and it's something that comes up quite a lot with patients, they go to a clinic and they have to have tests done that they feel they've already had done again? And why does that happen?
So sometimes it will happen because of the time interval between when the test was done and the time the patient arrives in clinic. So, for example, something like an AMH level, which is a blood test to look at your ovarian reserve, it is quite time sensitive. So if you had an AMH from a year ago, that represents the number of eggs you had last year, but not necessarily the number of eggs you've got today. Whereas if you had the AMH done a month or two ago, it's probably fine. Some tests don't really change. So, for example, an evaluation of your fallopian tubes, which is one of the more unpleasant tests that patients will sometimes themselves going through. It's very unusual to have to repeat a tube test. So I would always check with the doctor if they're asking for something to be repeated. It's entirely legitimate to say, look, I've had this done. Do I really need another one?
And how long might that appointment last? I appreciate it probably varies between clinics, but what kind of length should you expect?
Most appointments are around about 30 minutes. In 30 minutes, you should be able to get a really good conversation going with your doctor or nurse about what's going on and be able to ask all the questions you need and for them to ask the questions that they need. Some clinics will have appointments a little bit longer and they will often include an ultrasound scan as part of that initial appointment.
And in terms of emotional support, is it normal to be offered counselling at that stage, or does that tend to come later once you're actually starting treatment?
So it would depend on the individual backstory that you come to the clinic with. Um, all clinics offering fertility treatment have to be able to have the ability to offer patients counseling and support. Often that's done a little bit later in the process, sort of an implications counseling, where the people are saying, well, look, this is what we're planning to offer. How do you feel about this? What do you feel your needs might be? And particularly where things like donor sperm or donor eggs are involved, where there's a medical legal part of the implications counseling. But there'll be other couples who are having a really tough time during their journey to try and conceive, and actually they will benefit from accessing counseling and support services from the very beginning.
And what are the next steps after that appointment?
So usually the next steps will be to have the investigations performed. And clinics vary on this. Some clinics are fantastic and are exquisitely sensitive to the time issue that patients find so important. Other clinics have much longer waiting lists, and it's much more difficult. So hopefully the next step would be to have timely investigations done. And again, many services will have those results available very quickly. Most people who work in this field, I think, really do get and understand the time sensitivity that's important to patients. So clinics should always try and do their best to optimize and shorten that path. And then after you've had all your investigations done, there'll be a follow-up appointment where all of the investigations will be reviewed. And at that stage, you will have quite an important discussion. And it should cover issues such as, is this going to happen naturally? Is there anything we can do to help it happen naturally? Or indeed, is it more appropriate to consider some type of fertility treatment and those different options? Because there's lots of different fertility treatments available. Many people think IVF is the only option on the board, and that's simply not the case. So the doctor should be able to talk you through and individualize the options to your situation. So you have the ability to make an informed decision of what feels right to you.
And finally, I just wanted to ask you, as a consultant who sees lots of people at these first appointments, would you have any tips for people?
My top tips would be try and go with your partner or a friend. And my second top tip would be write everything down. Um, Doctors have got much better these days at communicating with patients with letters afterwards. And that letter should summarize your chat and list the options available to you. So you don't want to walk out of that room not being able to recollect all of the important things that have been said.
Stuart Lavery, thank you so much. That was incredibly informative and really useful. So thank you.
Hey, thank you.